Your Excellency, Ambassador of Ukraine to the Slovak Republic, dear colleagues, I understand both Slovak and Ukrainian when you talk. I understand the content, not all the words. That's why I don't need a translation, but allow me to speak English because I'm not fluent in Slovak or Ukrainian. I'm here and given 10 minutes, I understand that I have 10 minutes. I would like to share with you our experience here in Slovak Republic and in the region, and update you what is the current situation. Probably you learn about that from different sources of information, but the work that we are doing and international organizations are doing in Slovakia is not that visible. That should be. We are working silently and we are doing our mandate and mission. After the crisis, when the crisis started, WHO activated emergency framework just within another emergency, you know, this COVID-19 pandemic. From one emergency, we turned to another emergency, which is brutal and which is not understandable to the international community in 21st century. But we have to do our job and our mission, which is to protect health of people and refugees in particular. So in Poland, in Krakow, we have an extension hub of WHO and many other international organizations, which immediately activated supply of humanitarian aid to Ukraine. Slovakia didn't ask and doesn't ask any humanitarian aid. Slovakian government generously and kindly took on their shoulders all the burden, financial and other, to meet the needs and address the needs of Ukrainian refugees. You can imagine that Slovakia and many neighboring countries and hosting, receiving countries, they haven't faced this kind of scale challenge before. Influx of tens of thousands of refugees every day. So the initial phase, it was a little bit chaotic, but all the institutions have been working because Slovakia is a very disciplined country. You know, all the institutions are very disciplined. They work according to all the instructions and guidelines. We have provided the first recommendations and guidelines on the border, entrance, first medical care, evacuation, if there is a need for evacuation, and first contacts with the health facilities, triage, and then distribution of the patients who need care. We work closely with the Ministry of Health. Unfortunately, we don't have representatives of the ministries here. They can very openly tell you what substantial work is government doing. However, as an affiliated, because the Ministry of Health is our main counterpart, we are based in the Ministry of Health. I can tell you that we are in the daily contact with the Ministry of Health to review and to assess the needs of refugees. There are two important elements that I would like to share with you. First is what strategy government of Slovakia will adopt for the long term, because now we turn from the humanitarian phase to more stable situation where we can assess, and we assess this situation for Ministry of Health. We provided them the recommendations, what they can expect in coming months and years, because now we have to plan for at least 1 year, maybe 2, because this crisis will not end with the end of the war or reconciliation, because this crisis will have further consequences. Then we have to plan for a year or two. That's the first strategy. Initially created parallel structures like humanitarian centers or residential areas for refugees, those should be removed. And we are backing this strategy of the government and line ministries, Ministry of Health and Education and Social Care, which means that humanitarian centers that have been created as a temporary allocation and accommodation for refugees, there are many risks associated with these humanitarian centers, and the refugees who are in those centers should be integrated into the society. Integration of their employment, education, and healthcare services. This is now being discussed in the government of Slovakia, and all international organizations, including UNICEF, which is represented here, UNHCR, International Federation of Red Cross, we, Doctors Without Borders, there are many local non-government organizations. We all work on supporting the government to implement long-term strategy, more comprehensive, more inclusive, more universally covered insurance scheme, because if the refugees will be employed, they will be involved in insurance schemes, and currently public insurance agency is compensating for almost all health services that refugees get. Emergency healthcare is covered fully if people need life-threatening conditions to be cared. Essential services also covered if there are acute situations for the patient. No one left behind. However, there are still gaps. We know about these gaps. We have a daily talk with the Ministry of Health. Ministry of Health is committed to investigate, to address any individual case that we find out in the fields. Our field officers of international organizations working in the fields, they notify us about those cases. If any individual, any refugee faces the unmet needs or barriers to access to the healthcare, we are being notified, and we discussed each individual case with the Ministry of Health and try to find solutions. So just to conclude, we go to the direction to integrate refugees into the existing health, education, and social systems. Ministry of Health stated that they can cover the health needs of from 70,000 to 100,000 based on their resources now. But if additional resources needed, if influx, in case if the number of refugees will be increased, then they have backing both EU and international organizations. So we will do everything for the extension of the services. Just 2 sentences about the Ukrainian health workers. The next strategy is to integrate Ukrainian health workers, those who are refugees. We do not have yet recognized permission to individually work in the health system of Slovakia. Lex Ukraine will speed up that process of recognition of the qualification of those health workers in order to integrate them to these services. Especially those services will be organized and extended for refugees. This is all I wanted to tell you within 10 minutes, maybe beyond that. Thank you. If you have any questions. Question? You have a question? English better, yeah.
Hi, my name is Tomáš Salaj. I'm the chief physician of this Bratislava region and the only person who founded an outpatient facility for Ukrainian refugees. in whole Slovakia. And I can say that what you now told to the people is not very true. The Ministry of Health does not do anything for the healthcare provided for refugees. And I know very good, because it's 3 months I'm fighting this fight with government and with Ministry of Health. I'm asking and begging for support to provide healthcare for Ukrainian refugees. I founded an outpatient facility for children and for adults. We have hundreds and hundreds of patients every week. We are losing money on that because it is not reimbursed in proper way. And we are every day witnessing problems with providing healthcare in the rest of the system in Slovakia, because there is a lot of problems, barriers. There is a lot of prejudices from other physicians. There is the language barrier. There are a lot of problems, and we are witnessing really, I have a lot of tears in my eyes when I read the stories of the people who are trying to help their children, and they are sent back that, no, we are not providing care for your child because we do not know who will reimburse that. I read a very, very sad story of a mother who came with a child to our center. The child had a problem with the growth hormone, needed resupply of growth hormone. We provided all the care we could in the outpatient facility at GP, and we sent the mother with the child to the children's hospital and to another hospital. And in both hospitals, they were sent back that, no, we will not deal with you. And after 1 week of intense phoning to other people, stakeholders, the family went back to Ukraine because they were unable to be treated in Slovakia. And it's just one case of hundreds we are witnessing. I know that the Ministry of Health is giving you the individual cases in which something doesn't work, but the Ministry of Health doesn't know. They haven't been yet once in the center we created for Ukrainians. Never. They never asked us, what are our problems? They never came. They never offered any kind of help. I wrote two letters to the Ministry of Health and to the Prime Minister. I talked to them personally 1 month ago, and they didn't help. Why I am doing this? Because I believe that we have to help. I know that we have to do it because otherwise the patients would go to the Slovak doctors and there would be a lot of conflicts. There are a lot of conflicts in the Slovak outpatient facilities. And I do it because, thank God, there is UNICEF, because UNICEF, I don't know why, is funding the salaries of the people I put in the outpatient facility, because it's Ukrainian doctors, Ukrainian nurses, under supervision of Slovak people. So it's a lot of money because I need a lot of personnel just to provide it correctly, lege artis, the healthcare. And the government is not doing anything in the sense, how can I import this separate topic? How can I import a pediatrician in Slovakia? Normal doctors, physicians are okay, not accepted at the Ministry of Education. But people who finished pediatrics in Ukraine, they are not physicians and they are not accepted in this country. They cannot do any kind of medical work.
Can I reply?
And it's a problem that should have been solved by the government. I cannot solve it from the perspective of a provider of healthcare. Thank you.
Okay. I will not reply to the emotional part of your speech. I will talk about the facts. So please be respectful to anyone. If you are a doctor, you have to respect it to your patients, to respect it to me as well. And what you are saying that I'm not saying the truth, which means that I'm a liar. You have to be very careful in your statements. But at the end of your statements, you came to the objective part. Starting from the emotional, I was exactly talking about the problems that you have mentioned. But stating that the government and the Ministry of Health is doing nothing, it's a false statement. Ukrainian government people are very thankful and grateful to the Slovak government, which is taking care. Of course, there are problems. We know about those problems. One of the problems is the legislation. Yes, this is an EU country with its legislation, and we can't. We have to work all within the legislation of the country. For example, we cannot import any medicines, devices which are not registered in this country. We cannot practice in this country medical care without permission and license of the Ministry of Health, because someone has to be responsible for malfunction. Who will be responsible for malfunction? That's the question legitimately raised by the Ministry of Health. If there are Slovak doctors like you, sir, are you listening me? Sir, can you listening me? Okay. Because you are talking parallelly, please listen to me and my reply. You're a Slovak doctor and you work with the Ukrainian doctors under your supervision. That's the way we have to go forward. That's the way how the legislation has to integrate them step by step by the recognition of their qualification and speeding up that process. Otherwise, this is a country with its rules, norms, and regulations, and we have to respect even in emergency situations. Of course, we've discussed with UNICEF and other organizations how we can support, and they kindly provide the salaries, but all this is temporary arrangements. Long-term perspective means that integration to the social health insurance schemes, that's the long-term strategy that we are looking for. You might be dissatisfied with the performance, but please share with me these two letters that you are talking about, the copies of that, and I promise you I will discuss those. If there are any objective arguments that you are bringing, I can be a mediator between you and the Ministry of Health.